Today, let's break down the Atlanto Occipital and Atlantoaxial joint in the simplest way possible. Why can you not? Yes. But rotate your head? No. The answer lies in just two joints at the top of your spine. They are clinically critical. These joints are Atlanto Occipital joint and Atlantoaxial joint. Atlanto Occipital joint. This joint connects the atlas cervical vertebra number 1 with the occipital condyne of the skull. Think skull sitting on atlas. This joint allows nodding, yes, slight side tilting. This is the synovial joint and there is no intervertebral disc between cervical vertebra 1, atlas and occipital condyne. This joint is stabilized or the movement of the joint is limited by anterior atlanto-occipital membrane, which later became anterior longitudinal ligament, and posterior atlanto-occipital membrane, which later became ligamentum flavum. This joint function as yes. Another is Atlantoaxial joint. This is the joint between cervical vertebra 1, atlas and cervical vertebra 2 axis. There are 3 joints in here, 2 lateral joint, phases joint and 1 median joint, biboth joint. The key structure is the dense odontoid process of the C2. This joint function as head rotation, saying no. This is also synovial joint and no intervertebral disc between C1 and C2. This joint is stabilized by alar ligament, which limit excessive rotation. And this is the alar ligament, and this is the transverse ligament of the atlas. Now, let's recall the clinical path. Atlantoaxial dislocation or subluxation, which happen when the transverse ligament of the atlas rupture, which can be caused by trauma like a Jefferson fracture or rheumatoid arthritis. What goes wrong? The discs become unstable and move backward into the spinal canal, which can compress to the spinal cord, leading to quadriplegia, and if the disc compress into medulla oblongata, which can lead to respiratory failure and sudden death. So, what normally hold the disc in the place? These are alar ligament and transverse ligament of atlas, and another one is tectorial membrane, which is the continuation of posterior longitudinal ligament. So, how we can know the transverse ligament tear? If the atlanto-dental interval increases, it suggests transverse ligament tear. This is the anterior arch of the C1, atlas, and dense odontoid process of the C2. The distance between them is the atlanto-dental interval, which is less than or equal 3 mm in adult. If the atlanto-dental interval more than 3 mm, it may be transverse ligament tear. How we can check the transverse ligament tear? It can be seen in the open mouth odontoid view. This is normal ATI. Atlanto-dental interval less than or equal 3 mm, more than 3 mm suggests transverse ligament tear. Let's lock it in. Atlanto-occipital joint, yes joint. Atlantoaxial joint, no joint. C1, support the skull. C2, dents allow rotation. No intervertebral disc in either joint. Transverse ligament is the most important stabilizer. Here are my references. If this made things easier, hit like and save for revision. What more fast anatomy breakdown? Subscribe and keep learning smarter, not harder. Thank you.